Imagine a man finally puts his embarrassment aside and decides to do something about his erectile dysfunction. He visits a doctor, and as expected, the doctor prescribed the first-line treatment for erectile dysfunction, Sildenafil, better known by its brand name Viagra, or other medications like Tadalafil and Sildenafil are often the first treatment doctors recommend for erectile dysfunction. All of these drugs belong to a class of medications known as PDE5 inhibitors. But for some men, the story doesn't go as expected. They take the pill, wait for the magic to happen, and then nothing. Or maybe it works for the first few times, but with continued use, the effect gradually becomes weaker and weaker until it eventually stops altogether. And surprisingly, this is a common scenario. To understand why Sildenafil and other PDE5 inhibitors don't work for some men, we first need to talk a little about the process of a normal erection in a normal healthy man. If you are not interested in this part, you can escape to the next section using the timecode below. From a medical perspective, an erection is not a single, simple event. It is a carefully coordinated chain reaction that begins in the brain, travels through the nerves and blood vessels, and ultimately results in an erection. And if anything in that chain breaks down, medications like Viagra may not work the way you expect. Sexual stimulation activates specific areas of the brain and creating arousal. The brain then sends nerve signal down the spinal cord to the penis. These nerves releases a tiny but incredibly important molecule called nitric oxide. Nitric oxide triggers the production of another molecule called cyclic GMP or cGMP inside the penile tissue. Cyclic GMP then relaxes and widens the blood vessels supplying the penis, allowing a large amount of blood to rush in. As blood fills the erection chambers, an erection develops. Think of it like inflating a car tire. As tires fill with the air, it becomes firm. The same thing happens in the penis, except instead of air, it is blood filling the specialized chamber. But an erection cannot last forever. Like many other biological systems, there is always a balance between on and off mechanisms. Cyclic GMP promotes erection, while an enzyme called PDE5 acts as a natural switch off. PDE5 gradually breaks down cyclic GMP. As cyclic GMP levels fall, blood flow decreases, the erection subsides, and the penis returns to its normal flaccid state. This is where drugs like Sildenafil or Viagra and Tadalafil or Cialis come into play. These medications block PDE5 enzyme. As a result, cyclic GMP remains active for longer, allowing blood vessels to stay relaxed and helping erection become stronger and last longer. And as you can see, PDE5 inhibitors can act only in one step in a long and complex process required for an effective erection. And there are many reasons why PDE5 inhibitors may not work. Clinically, we can group the causes of PDE5 inhibitors failure into two categories: reversible causes and irreversible or unidentifiable causes. Reversible causes of PDE5 inhibitors failures are numerous. Number one is incorrect use of the drug, especially not taking Viagra at the proper time or in proper situation. After you take Viagra, it needs time to be absorbed into the bloodstream, and it usually absorbed within 30 to 60 minutes. From there, it travels through the circulation and eventually reaches the penile tissue. If you take the pill immediately before sex, the medication may still be in your stomach, meaning a small amount has entered the bloodstream and it has not reached its full effect yet. Taking Sildenafil or Sildenafil with alcohol or a high-fat meal can also reduce the speed and extent of their absorptions. However, Tadalafil absorption is not significantly affected by food. You can take Tadalafil with or without a meal, but Tadalafil typically starts working after about 2 hours, and its effects can last for up to 36 hours. This is why it is often recommended to take it well before sexual activity, and take advantage of this long 36-hour window. Number 2 is the issue of dosing. Many young and otherwise healthy men started with 50 mg, which is considered the standard dose. Older patients or those with liver cirrhosis and renal impairment usually start with 25 mg because drug metabolism and clearance are reduced in these groups of population, and this increases the risk of side effects. The dose then gradually titrated upward with a maximum of 100 mg in one day. Doses above 100 mg slightly improve response in some cases, but this significantly increases the risk of side effects. In fact, up to 31% of users discontinue the drug due to adverse effect in high doses. For Tadalafil and Sildenafil, treatment is typically started with 10 mg and titrated upward up to 20 mg depending on the response and tolerance. But we have to keep in mind that we are human and we are not copies or clones of each other, and the same dose might not work for everyone. Sometimes increasing the dose might help to get a proper response. Number 3 is a condition known as tachyphylaxis. In simple terms, it means reduced responsiveness to a drug after repeated use. In one study, about 17% of users discontinued Tadalafil after 2 years because they felt it stopped working effectively. And a laboratory study also suggests that very high doses of Tadalafil may increase the expression of PDE5 enzyme in the penile tissue culture. This could lead to faster breakdown of cyclic GMP, resulting in a reduced erection strength and duration over time. And this may provide a possible molecular explanation for the tachyphylaxis. However, it is important to note that tachyphylaxis has not been clearly proven in clinical practice. Also, the doses used in laboratory experiments were significantly higher than standard therapeutic doses for erectile dysfunction. Number 4 is comorbid conditions. Many men with erectile dysfunction also have underlying health conditions that are themselves major risk factors. These include diabetes, hypertension, cardiovascular disease, benign prostatic hyperplasia or BPH, smoking, and other chronic illnesses. The more of these risk factors are present, the lower the responsiveness to medication like Sildenafil, Tadalafil, and Vardenafil tend to be. However, controlling those underlying conditions can significantly improve erectile dysfunction and enhance the responsiveness to PDE5 inhibitors. One study showed that optimizing risk factor before starting Sildenafil therapy increased responsiveness to up to 82%, with 77% of users achieving success on each attempt. Number 5 is psychological factors. In some cases, treatment may be perceived as unnecessary, and some men may develop a fear of side effects. Relationship problems between partners can also play a major role. The challenge is that Sildenafil and other PDE5 inhibitors do not directly address the psychological or relationship-related issues. So, medication may not work as expected if those underlying problems remain unresolved. In these cases, sex therapy and psychological counseling can be very helpful and may significantly improve the responsiveness to treatment. Number 6 is hypogonadism, a condition in which the testes do not produce enough testosterone, the primary male sex hormone. However, low testosterone is more commonly associated with reduced sexual desire and decreased frequency of sexual activity, rather than a complete loss of erection. The use of testosterone therapy for erectile dysfunction is still being studied and is not considered a standard first-line treatment. But animal studies have shown that testosterone replacement in castrated animals can reverse apoptosis of cavernosal smooth muscles, which means the programmed cell death of erectile tissue. It has also been shown to reduce the decline in nitric oxide synthase enzyme and PDE5 enzyme expression that occur after castration or with aging. Consistent with these findings, testosterone has been shown to improve sexual function in hypogonadal men. Recent studies suggest that men with symptoms of hypogonadism have a reduced response to PDE5 inhibitors. In such cases, testosterone therapy may improve the response to Sildenafil and other PDE5 inhibitors in men with erectile dysfunction who have a low baseline testosterone level. For example, treatment with 1% testosterone gel has shown to improve erectile function in hypogonadal men who did not initially respond to testosterone. Larger randomized controlled trials are still needed to clarify the role of combining testosterone with PDE5 inhibitors. Number 7 is simple but very important. Some men simply give up too soon. They try Sildenafil once, don't see the results, and immediately assume the medication is not effective. But in reality, the first few attempts may fail for many reasons, and multiple trials are often needed before the drug shows its full benefit. And you might wonder, if it didn't work in the first time, why would it work later? And logically that seems reasonable. But surprisingly, research showed that this is often not the case. One study followed 12,076 men in a randomized double-blind placebo-controlled trial conducted between 1996 and 1998, during the early years after Sildenafil was introduced. Double-blind means neither the patients nor the researchers know who receiving active drug and who receiving placebo. This design helps reduce bias and increase the reliability of the results. The researchers found that after the first use of Sildenafil, about 54% of men reported successful intercourse. By the second attempt, this increased to 64%, and by 8th attempt, approximately 86% of men reported success. In other words, many men who initially believed the medication was ineffective eventually achieved success after repeated use. Then there are irreversible or unidentifiable causes of PDE5 inhibitors failure. In these cases, the medications simply do not work, and no clear underlying cause can be identified. And when PDE5 inhibitors fail, There are still other treatment options available for erectile dysfunction, and we have discussed those in a separate video, which is here. If you are interested, check this video out.